Welcome, everybody. I am Michael Goldschmidt of the National Healthy Homes Partnership. I am pleased to be organizing your webinar today. This webinar is sponsored by HUD's Office of Lead Hazard Control in Healthy Homes, joined by other HUD program offices. We're also grateful for the participation of the U.S. Centers for Disease Control and Prevention and the Washington State Department of Health. This call is not intended for media. Media can direct their questions to media@cdc.gov. Today's webinar is Public Housing and COVID-19. Our panelists are Tara Radosevich, Dr. Jennifer Murphy, and Nancy Bernard. Tara Radosevich is in HUD's Office of Public and Indian Housing, Office of Public Housing. She has a background in environmental science and helps coordinate environmental health issues for PIH. Jennifer Murphy currently serves as the team lead on CDC's Water, Sanitation, and Hygiene, or WASH, team for the COVID-19 response. She has also participated in CDC-led waterborne disease outbreak response, both domestically and internationally, as well as performed laboratory-based studies of disinfectants for use in waterborne disease outbreak prevention and response. And then finally, we have Nancy Bernard, MPH, REHS, CPSI, who manages the Washington State Department of Health indoor air quality and school environmental health and safety programs, providing technical assistance, resources, and training for local health jurisdiction and K through 12 school staff. We are pleased that you have joined us for the event. I'd like to go over a couple of logistics real quick. The first is the webinar will last approximately 45 minutes with 15 minutes at the end for questions. We are recording this webinar and posting it on the HUD Office of Lead Hazard Control Healthy Homes website, hud.gov/healthy homes, for your viewing later if you prefer. If you have questions before then, please feel free to post them in the questions window and we'll try to answer as many as we have time for. One last thing, because we have so many people on this webinar and we have multiple presenters in multiple locations, with multiple internet speeds. We may lose a little bit of the sound. If we do, if you will just pause, we're going to get the presenter back on as clear as we can get and continue on for where we paused. I will ask you, if you lose sound or have trouble with the sound, don't use the questions window if you can to let us know that, because usually we'll already know, and the problem is then we'll have trouble finding the actual questions. So just leave the questions for the chat window, and if you lose sound, we'll work on it and try to get it back as soon as you can. If for some reason you get knocked off of the webinar, we are recording it and you will be able to get it. You will get an email tomorrow that explains where that recording is. So without further delay, I'd like to introduce our first speaker, Tara Radosevich.
Hi, thanks, Michael. This is Tara Radosevich. I'm, as Michael said, I'm in the Office of Public Housing within Public and Indian Housing. I have a lot of content here in these slides. I'm not going to cover it all. I'm just going to go through it quickly just to make sure those housing authorities on the line are aware of it. Many of you were hopefully on a call Friday with our Assistant Secretary, Hunter Kurtz, and our Deputy Assistant Secretaries to go over in detail the new notices that have come out of my office related to funding under the CARES Act to respond to and prevent COVID-19 infections. So I'm just going to cover it really quickly. All of these materials are available on HUD's website. It's hud.gov/coronavirus. I'm going to show you some more websites and notices you should look for. And then we have email boxes and places where you can get more information. So do not worry if you can't digest everything today. And again, I am going to just go through it quickly because I don't want to take any time away from the experts that are on this call. Thank you so much to the Office of Healthy Homes for putting this together, and for CDC and Washington for participating. It's great to be able to make these experts available to housing authorities to answer questions so that we can help you do better to serve your residents and prevent infections. So as I mentioned, we have a lot of resources. We've been working fast and furiously since March to put out answers to questions we've been receiving. There's an eviction moratorium that's been put in place with the passage of the CARES Act. We put out some guidance on that. We put out a notice about waiving some of the requirements. We had, as soon as the some of the shelter-in-place orders started rolling out across the country. We had a ton of questions on how housing authorities can continue to do housing inspections. What are they supposed to do if they don't have PPE? Should they be going into residence units? Should they be meeting with them? Can they have their public meetings? A lot of those questions are answered in our FAQs, and they're in these guidance and these notices that were put up. We received under the CARES Act broad authority to temporarily waive a lot of the requirements housing authorities typically have to meet to administer their programs. But with those notices, we've asked our housing authorities to the extent that they can to continue leasing because we want leasing to still happen. We still care very much about serving persons that are perhaps homeless. It's safer for those persons to be in their own unit or home versus in a group setting or shelter. So we wanted all of our housing authorities to remember that while we're waiving all these things, we're waiving them so that you can continue to lease and continue your essential operations safely. The biggest news is that we put out guidance on our funding under the CARES Act. So with the passage of the CARES Act, we have virtually unprecedented flexibility for housing authorities in how they can use their funding under the public housing and the housing choice voucher or tenant-based rental assistance programs, flexibility in how they use it and what they can spend their funds on with new provisions previously housing authorities could not pay for, especially in the area of resident services. And I'll talk about that in a few slides. As I mentioned too, we've got dedicated mailboxes. So these are a lot of email addresses coming at you here. Probably the easiest one is this PIH-COVID@HUD.gov. That is a general mailbox that we're using for all kinds of COVID questions from our housing authorities and from the public. But there are some specific ones for specific needs. So if you're a housing authority and you're not sure if what you're trying to achieve has been waived under our waiver notice, you can email the COVID waivers box. Or if you have if you have a question about how you can use your funds, either under the voucher program or the public housing program, under the voucher program, we have this financial management division. So if you email the COVID mailbox, you're going to get to the right place. It's just you can get there faster with some of these other web addresses. And then, as I mentioned, we have this HUD.gov/coronavirus webpage. That covers all of HUD programs, and you can drill down into the specific program that you're administering. We've all been working really quickly, and some of this information is still siloed, but it's also because the requirements vary. So the requirements for an emergency shelter grant under the Community Planning and Development Office of HUD, they may be slightly different than what we're allowing under the public housing or voucher program. So you've got to go to the specific program to get those questions answered. All right, so the CARES Act. So I highlighted here in yellow the great, important, exciting news, which is that under our public housing and our voucher program, we've got funding for supporting and maintaining the health and safety of assisted families and the costs related to that, essentially for owners. It's rare that HUD ever provides funds to support owners that participate in our tenant-based rental assistance program, so this is new. But specifically under the Housing Choice Voucher Program, our housing authorities can use their administrative funds to do more than they previously could. So some of the things that they could cover. So I should fill in here. So HCV is the Housing Choice Voucher Program. That is tenant-based rental assistance. We also have what's called project-based voucher buildings, or PBVs. Basically, that's when a voucher, tenant-based voucher, is now attached to a unit. We could have buildings that are all project-based vouchers, or we could have a building where there are just some project-based vouchers. So with these HCV funds, these new funds that came out under the CARES Act, there's new things that the housing authority can pay for, like relocating families to other units, supportive services, transportation costs, and the biggest new one is costs for providing childcare to housing authority staff. They can cover the cost of delivering goods like food and medical supplies. We haven't been asked about this yet, but it's an authority that's in there, is that if the housing authority wanted to pay for some security costs, they could do that, and other administrative fees related to staff and services that they would need to perform during an outbreak. So if there is something, the big message with this new administrative funding is that the housing authority needs to read the detailed notice. about what can be covered. I just gave you a few examples of things that could be covered. The details are in our, it's on an earlier slide, but we'll share it too. I think it's 2020-08. But if there is something that the Housing Authority is curious about whether they could fund, they can email this box to get a decision from our financial folks. For public housing, again, it's funds to prevent, prepare for, and respond to coronavirus. Another big change that came with the CARES Act is that we are allowing public housing authorities for public housing. They're allowed flexibility between their operating funds and their capital funds. For those that aren't in the public housing world, this may seem like a lot of jargon, but it's a big deal for these housing authorities because operating funds typically go for your staff expenses, your day-to-day things, maintenance and upkeep of units, whereas your capital expenses could only be used for major things like capital repairs, modernization, development. So giving housing authorities that flexibility between those two accounts helps them move money faster, and the tracking and reporting and planning requirements are less than they previously were. That is just so for these funds, and there's a limit on how long this authority and flexibility is available to them, and I think it's December 31st. This is another one that these details are in the notice. And so that's PIH Notice 2020-07. That's up on our website. PHAs are getting a big chunk of money, and we're asking them to spend this money first. So again, just like with the voucher program, it's for supporting or maintaining the health and safety of assisted individuals and families, and to support education and childcare costs for the impacted families. Here are some of the examples of things that can be paid for in the public housing program: delivering service goods, essential services, childcare costs, coordination with local health service providers, and assisting their staff as well. That first one, creation or update of an infectious disease outbreak plan, that one's kind of funny in that, you know, we're just giving them the money now, and hopefully they wrote that a long time ago, but this will pay for tweaking that. Changes to their community areas, to perhaps their rental office, how they meet with staff, they can make physical changes there. Cost potentially of isolating persons, like if they want to separate from their family, if they have contracted the virus, and then payments for staff and childcare. A lot of this, we have put this out there, but we don't have a large library of how the funds are being used yet because this is so new. And over time, we've been asking housing authorities to share with us what work you're doing, how you're using these funds. There are some good best practices out there that we will want to collect because it's fascinating to see how nimble our housing authorities can be and how they are responding to the needs of their residents. A little bit more here. Security costs could be included, transportation of residents, coordinating with schools. So this is a big one I want to highlight, which is that these funds could be used to help residents connect for the students. They could buy them tablets or low-cost computers. This is a big thing that's exciting to be available to public housing residents. This one, though, because we divide our funding, the voucher funding is very different. This isn't available for voucher residents at this time, but it is available for public housing residents. The big takeaway, again, we want the housing authorities to spend this CARES Act money first. They have to be careful about commingling funds. Questions can come into the general mailbox. If it's something that the housing authority thinks would be helpful in responding to or assisting residents, ask us, and we will gather folks to see if it's an eligible use of the funds. So again, questions, go to these mailboxes. That is the end of my presentation there. And with that, I will pass it to Dr. Murphy and to Michael again.
Okay, Dr. Murphy, I'm going to make you the presenter now. While this is presenting and changing, I just wanted to remind everybody, so there are some handouts. Jennifer, you could accept there should be a pop-up window that you should accept. There you go. There are some handouts. We know that one of them, people are having trouble opening. Tomorrow, this recording will actually be posted on the HUD website and the HUD Office of Lead Hazard Control Healthy Homes website. And with that will be the PowerPoint presentations and the handouts that will work. So don't worry if you can't download them. Having said that, Jennifer, we're ready for you.
Okay. Thank you, Michael, and the Office of Healthy Homes for providing the opportunity to speak today. So my name is Jennifer Murphy. I am an environmental microbiologist. I'm working as part of the water, sanitation, and hygiene team within CDC's COVID-19 response. And today I'm going to talk a little bit about prevention and some messages, some of our core messages on cleaning and disinfection. Okay, so for an overview of today's presentation, I'll first talk a little bit about the coronavirus disease, or COVID-19, and some ways that you can protect yourself and others. We'll go into some information on face coverings and social distancing, and then into the cleaning and disinfecting messaging for homes and for public spaces, and then I'll finish up with a few CDC resources. So COVID-19 is caused by the virus SARS-CoV-2. The first US case was reported in January of 2020. And as of yesterday, there were over 1.1 million cases and almost 66 from 50 states, and 7 US affiliated jurisdictions have confirmed cases. And there's a link here at the bottom where you can go and see more about the cases that are being recorded and followed in the United States. So how does the disease spread? The virus is mainly spread from person to person. So this is between people who are in close contact with each other. This is within about 6 feet. And we believe that it's mostly spread through respiratory droplets that are produced when a person who's infected either coughs or sneezes. So these droplets can land in the mouths or noses of people who are nearby, or they could possibly be inhaled into the lungs. We do know that people without symptoms may be able to spread COVID-19. So these are called asymptomatic people. And people may be able to get COVID-19 by touching a surface or an object that has the virus on it and then touching their mouth, their nose, or their eyes. So some of the symptoms of the disease, we have a list here. So cough, shortness of breath, fever, chills, headache, muscle pain, sore throat, loss of taste or smell, repeated chills. There's a wide range of illness severity that's been reported, from mild to severe illness. And we do know that this can result in death. The estimated incubation period is 2 to 14 days. And some of the major complications from the disease include pneumonia, respiratory failure, and multi-system organ failure. And there's a link here at the bottom called Symptom Self-Checker, and this takes you to a page on the CDC website. It provides a guide to help you make decisions and seek appropriate medical care. So there's a number of ways you can protect yourself and prevent the spread of disease. So one of the main ones is avoid touching your eyes, nose, and mouth with unwashed hands. You can also avoid close contact with people when you're not at home. So this is what we call social distancing. And we know that hand washing is very important. So washing your hands with soap and water for at least 20 seconds. And if soap and water are not available, use an alcohol-based hand sanitizer that has at least 60% alcohol. And we also encourage cleaning and disinfecting frequently touched objects and surfaces. So I'll talk more about that in a minute. There's a couple of other ways that you can help prevent the spread of respiratory illnesses. So one of the main ones is to stay at home when you're sick. Also practicing respiratory hygiene. So this is covering your cough or sneeze with a tissue or using the inside of your elbow, and then throwing away those used tissues and washing your hands immediately afterwards. We also encourage avoiding close contact with people when you're not at home. So again, the social distancing, and wearing a cloth face covering over your nose and mouth when you're in public, especially when you're not able when you have to be around other people. I do want to note that cloth face coverings are not a substitute for social distancing. So what can you do if you are sick? One of the most important things you can do, again, I'm going to say these things over and over again, is to stay at home. So most people recover at home without needing any additional medical care. So in general, just staying away from people as much as possible. It's important to wear a cloth face covering if you must be around other people, like caretakers. Cover your coughs and sneezes, wash your hands often, avoid sharing personal household items, and then cleaning and disinfecting frequently touched objects and surfaces. And then if your symptoms do get worse, it's important to monitor those symptoms, and you'll see some emergency warning signs that include trouble with breathing, persistent pain or pressure in your chest, new confusion or inability to be roused by others, and bluish lips or face. So we advise to call ahead before visiting your doctor, and if you do call 911, let the operator know of your COVID status, and to put on a cloth face covering before the help arrives. So we have a little bit of guidance here on ending home isolation. So there's 3 different categories. The first one, with a positive COVID-19 test, there are three conditions here that one should meet to be able to end home isolation. So no fever without fever-reducing medicine, and other symptoms have improved, and you've had a negative test 2 times in a row that were administered at least 24 hours apart. Without a positive COVID-19 test, we recommend no fever for 72 hours without fever-reducing medicine, and other symptoms have improved, and 10 days have passed since symptoms began. And then lastly, with a COVID positive test but no symptoms, we actually recommend 10 days have passed since a positive test, and that's brand new guidance that came out, I think, over the weekend. So 10 days have passed since positive test, and no symptoms since test. So I'll talk a little bit about social distancing and face coverings. We get a lot of questions about these. Social distancing tools that we have for slowing the spread of the disease. This means staying at least 6 feet from other people. We encourage not gathering in large groups, to stay out of crowded places and avoid mass gatherings. And then again, to wear this cloth face covering when you're in public, especially when you're going to be around other people. And we've got a lot of information about these cloth face coverings on our website if you're interested in learning more and some ideas of how to make these coverings at home. So into the cleaning and disinfection. So common household cleaners and disinfectants are very effective against this virus. What we encourage is to follow label instructions for use. So it's important to dilute the product properly to make sure you have the adequate contact time. So this is the amount of time that the product is wet on a surface, and the appropriate protective equipment, such as gloves, for using that product. We also say that household bleach can be used. So household bleach can be diluted, 1/3 cup of bleach into a gallon of water. That's very effective as well. And focusing on high touch surfaces, things like remote controls, phones, toilet handles, light switches, doorknobs, those are the ones to really focus your cleaning and disinfecting efforts. And if surfaces are dirty, so if they are visibly dirty, they have dirt or other types of materials on them, it's important to clean those with soap and water or other cleaners before adding the disinfecting product. So if someone in your house is sick, it's important to separate that person who's sick from others who are well in the household. So you can do this by setting up a sick room, and if it's possible, set up a sick bathroom for that person. And really just limit the sick room cleaning to on an as needed basis. We encourage that the sick person should wear a cloth face covering when the caregiver is in the room. And after a person who is sick has recovered, our suggestion is to close off that sick room and wait for about 24 hours before getting in there and cleaning and disinfecting. And it's definitely helpful if you're able to open some outside windows to increase the airflow within that room before you get started with the cleaning. So there's 3 main components of disinfecting with the right chemicals. So the first one is cleaning and disinfection should be effective. And what we mean by that is you should clean first, especially if the surface is dirty, and then use a disinfectant that is listed on EPA's registered disinfectants. It's called List N, and these are disinfectants that have been shown to be effective against this virus. It's important to follow the manufacturer's instructions for using these products. So with the application method is very important. And again, that contact time is something to really make sure that you follow. And again, if these List N disinfectants aren't available to you, you can use household bleach. Again, that dilution is 1/3 cup of bleach into 1 gallon of water. The second important thing to remember is disinfection should be efficient. So it's important to focus on surfaces and objects that are frequently touched by a lot of people. So again, doorknobs, light switches, phones, faucets, tables, remote controls, those kind of objects that are getting a lot of touch throughout the day. There's a number of surfaces that don't need to be disinfected. So surfaces and objects that aren't frequently touched. Walls, floors, sidewalks, ground covers, those kinds of areas do not need to be disinfected. And areas that have not been used by anyone in the past 7 days also do not need to be disinfected. Just practice your regular routine cleaning in those spaces. And then the third component of disinfecting is that cleaning and disinfection should be safe. And this is really important. So staff or persons who are using these different disinfectants should be instructed on how to apply them according to the label. So again, working with the correct concentration, making sure you have personal protective equipment that's recommended by the manufacturer, making sure there's sufficient ventilation in the room that you're in. And it's also extremely important to make sure you keep all of these disinfectants out of the reach of children and that they're stored appropriately. So here are a list of some CDC resources. Our website is constantly being updated. You can click on these links and can lead you to some more information on cleaning and disinfection, as well as some more specific information on hand washing and face coverings. Thank you.
Thank you, Jennifer. That was a fantastic presentation. I'm going to go ahead and change presenters now to our final presenter, Nancy Bernard. Nancy, your mic is actually muted. So if you could unmute your mic and I will change it to you. Okay, there, we can hear you now. So.
All right.
And we can see your screen. While you're getting up your PowerPoint presentation, I just want to make everybody aware, because there's a couple of questions coming in. We are recording this webinar, and if there is a little bit of sound trouble, just be patient, because we'll get it caught up. At the end of Nancy's presentation, I will be taking the questions you've been asking and try to get as many as I can in to the presenters. So without further delay, Nancy, we're looking forward to seeing your presentation.
Can you see my screen?
Yes.
All right, thank you. I'm Nancy Bernard from the Washington State Department of Health, and I've been teaching for years, primarily with school custodial and facility people, school nurses, and local health jurisdictions on cleaning and disinfecting. And so I'm going to add a bit, I hope, and not overlap with the CDC presentation. So one of the things I keep telling people with COVID-19 is this isn't new, that we're dealing with a respiratory virus. It's a new virus. There's some new twists to this virus, but we've been doing public health for a very long time. We have several ways that germs can spread. Foodborne and waterborne are two that get a lot of attention at the local, state, and federal health department levels with lots of regulations. We're going to deal more today with the person-to-person, the droplet transmission, which is primarily what COVID-19 appears to be, although you may hear, depending on how closely you watch the news, arguments over airborne versus droplet. but for our purposes, it's that 6-foot separation. And then the contaminated surfaces where people can pick up viruses. If you keep reading the information, the droplet transmission is considered the primary means of transmission of the SARS-CoV-2 virus. So again, this is not a new slide for me. I've been doing this slide for many, many years. Hopefully now people are really getting that message. Wash your hands with plain soap and water often. Cover your cough and sneeze. Don't touch your eyes, nose, and mouth. If you've touched a surface, do not assume that it's clean or sterile or disinfected. Yes, we're doing a lot more surface disinfecting now, but as soon as somebody comes by who is coughing, sneezing, or just talking and is infected, it can become contaminated quite rapidly. So my mantra is just don't assume that any surface that you touch is sterile, and don't touch your eyes, nose, and mouth unless you've just washed your hands. Get your vaccinations. That's going to become really important this fall when flu starts circulating again. And maintain really good ventilation. Dilution helps a great deal when it comes to respiratory viruses. There's still a lot of research going on about this particular virus, but in general, the more outside air, the better for your areas, communal areas. If you can increase that outside ventilation, that will help. And obviously, stay home when you're sick and support public health. Soap is really important, particularly with COVID-19, because if you've seen some of these articles, we know that soap actually breaks apart lipid envelope viruses, which influenza and COVID-19 are both two types of viruses that have these lipid envelopes. So soap with enough contact time itself will deactivate or kill this virus. Scrub for 20 seconds and you do not need antibacterial soaps. They're completely unnecessary. They can be bad for human health and bad for the environment. We don't care if organisms are living or dead when we wash them down the sink. And in general, antibacterial soaps are not going to kill viruses, and they don't kill a lot of bacteria, to tell you the truth. Hand sanitizers, you've heard a lot about that. They really are not a substitute for hand washing. They are not effective on dirty hands. So if you have dirty hands, you really need to find a sink with soap and warm water and hopefully paper towels. If you do use the hand sanitizer because you can't get hold of a sink, make sure you use enough of it that you're going to penetrate the mucus that protects viruses, or else it can't kill them. They are not effective on non-envelope viruses like norovirus. Most people are familiar now with norovirus. It's very prolific, causes a great deal of disability, and hand sanitizer is not going to work. You need hand washing. Alcohol is a flammable poison. It must be kept out of the reach of children and be careful with it. It should be fragrance free. Over 30% of people now are fragrance sensitive, and you want people to use these products, so don't include the fragrances. Non-alcohol hand sanitizers are not recommended. That's just period. They are not. This won't be in your PDF because I don't know where it came from. My nephew sent it to me because they know how I feel about hand washing. So sinks, it is time that we put more sinks. I was at a market the other day that has a petting zoo. Obviously not supposed to be used right now, but they had installed a sink with hand washing. We need more ability to do public hand washing. I work a lot with schools, and you're seeing sinks now in cafeterias and gyms. Hand dryers are popular in some circles, but they can spread germs around if people haven't washed them off their hands. And then you don't have that paper towel to open doors. And I personally never assume a door handle has been disinfected properly. I love my paper towels. And then I take them and I put them in my yard waste for composting. So I've told you I work with schools. There's a lot of organisms we deal with. Influenza, measles, and pertussis are all circulating now. They're all vaccine preventable. We hope COVID-19 will eventually be vaccine preventable. MRSA is a skin organism. So if you're operating communal areas, gyms and such, you know about cleaning and probably disinfecting any surfaces with skin contact to prevent the organisms that are transferred skin to skin. COVID is not one of them. This is a respiratory virus. It doesn't penetrate the skin. Norovirus, we've talked about that. Anywhere there's feces or vomit, that's got to be cleaned and disinfected, and that takes a higher level disinfectant. And so too does the C. difficile, which I don't expect you'd be dealing with. So a lot of times we talk about how hard it is to kill organisms. This is just for reference. And to let you know, the lipid envelope viruses like influenza and COVID-19 are the easiest to kill. So survivability of SARS-CoV-2, the virus that causes COVID-19, it may float in the air for about 3 hours. How long and how much of the virus is has an ability to cause infection is still to be determined. This is all preliminary studies. It can live on surfaces for up to 3 days, which is why if your building or facility has been closed for 7 days, the guidance is not to disinfect. It's not necessary. We don't know how much of the virus is staying really viable for 3 days. There's still a lot more to know, but that's the number we're going with right now. On copper, copper does kill organisms. We've known that for thousands of years, but we don't have a lot of copper surfaces. And cardboard, it doesn't live long on paper. It dries out and starts to die on paper. So clean, sanitize, disinfect. We've talked about that already. I'm just going to hit some highlights. One of the things we'd like is to see products used that don't cause asthma, don't cause people to develop asthma, and don't trigger asthma attacks. 1 out of 10 children in our country on average have asthma, and a lot of adults have asthma. Workers acquire asthma frequently from disinfectants, in particular bleach and the quaternary ammonia disinfectants. So all of these types of ingredients you might be using in your facilities can cause work-related asthma. And sprays, we don't want sprays, we don't want plug-ins, we don't want scented candles, potpourris, essential oils, etc. All of these can cause or trigger asthma, and they do nothing for human health or the environment. You want to ventilate adequately, change your air filters. If you can improve your air filtration, if you have mechanical ventilation to a MERV 13, that's the new recommendation, particularly in areas with traffic-related air pollutants and wood smoke. Air fresheners are never safe for human health. Clean has no scent. So this is a program from California. This is specific to schools, but they have a whole work-related asthma prevention program where you can get more guidance. Green cleaning. We recommend green cleaning. You always clean before you disinfect. Remember, cleaning will remove most germs and microorganisms, and unless you remove the organic matter, your disinfectants and sanitizers won't work. But here's another reason to use green cleaners. They produce a lot less of the volatile organic compounds that can cause health problems, sensitizations, asthma, headaches, etc. But you want to be really careful. There's a great deal of greenwashing, just like right now, there's a lot of products being marketed to businesses and schools and people that do not really do what they claim to do. So always read labels, front and back, read the safety data sheet, read the product data sheet. They should all agree. If you're looking for anything besides disinfectants and sanitizers, which have to be EPA registered products, you go for the third-party certification, Green Seal, UL Eco Logo, and the EPA Safer Choice programs. That's for all your products that you might be using except sanitizers and disinfectants. So here's another slide just to remind you, cleaning, that's first and foremost the most important thing to do. Then you apply your disinfectant and follow the label. And we're going to talk about a safer disinfection program. Well-ventilated space, you must have a safety data sheet. That's required by law. That's why we tell schools to not allow parents, teachers, and staff to supply their own chemicals. For keyboards and sensitive electronics, I recommend alcohol wipes. You can either have a bottle of 70% or more isopropyl alcohol that you spray into a cloth to wipe down surfaces, or use the alcohol wipes. And then it's best that people just not assume that any surfaces they touch are really sterile and not touch their faces. So EPA does have a program for safer disinfectants. So they register sanitizers and disinfectants based on how effective they are at killing certain types of organisms. And there's lots of classifications. And as you've already seen for COVID-19, it's the end list of products that they've not been tested against SARS-CoV-2. It's too soon for that, but they're considered able to kill SARS-CoV-2 because they're registered to kill organisms that are harder to kill than coronaviruses. So when you're picking your disinfectants, there's a lot of information out there. This is about types of disinfectants and their efficacy. So when we make recommendations, this is the kind of data that I use. If you notice the quats, which I'm recommending people move away from because there are asthmagens, they're also can cause reproductive problems. They're endocrine disruptors, skin sensitizers. They're also very low level disinfectants. I'm mostly recommending people consider the hydrogen peroxides and the alcohol products. So this is a study done in 2014. It was done before some of the alcohol-based disinfectants were on the market, but it's a really good source of information evaluating disinfectants if you're interested. EPA's Design for the Environment is a program for there's antimicrobial pesticides, and that's what sanitizers and disinfectants are. They're EPA registered antimicrobial pesticides. The Design for the Environment program is for designating safer disinfectants. So that will include disinfectants based on these products: hydrogen peroxide, lactic and citric acid, and alcohol, either ethyl or isopropyl alcohol. The products that may cause asthma, the quaternary ammonia compounds, there's 4 primary ones. We call them quats for short. Bleach, acetic acid, thymol, glutaraldehyde, and peracetic acid all can cause asthma. Here's 2 resources. The PDFs are posted to the website, or you can download them from these websites on choosing safer disinfectants. Bleach, just to be clear, is a disinfectant or a sanitizer. It is not a cleaner. So you have to clean the surface first if you use bleach. Never mix it with ammonia or acid products. Always have ventilation. And in my state, and I suspect most states, you are required to have an emergency eye wash if you mix it from concentrate. I did want to mention wipes. You can get safer wipes. So you can get, if you really want to use wipes, you can get HP and alcohol-based wipes. The traditional wipes have all been quats, and those are the ones that would be a good idea to move away from if you can. So high-touch surfaces have already been mentioned. Always try and have, actually the building codes require warm water for hand washing, but if people can't mix cold and hot water to get the temperature they like, make sure they're getting temperatures somewhere between 90 and 100 degrees, so it's not too hot or too cold to wash your hands properly. Some special concerns in public places: you should not use cake deodorizers like paradiachlorobenzene or naphthalene. Be very careful with terpene-based products. My general recommendation is to be careful with any of your botanical-based products because they tend to be very sensitizing and people start to react to them. Nano silver should not be used in the general environment. It's not good for the environment. Remember, everything you use goes down the drain. Air fresheners don't freshen the air. They put a lot of chemicals in there that stick to everything and can cause respiratory problems, eye irritation, migraines. Do not use ozone generators. I know it's, we've been saying that for years in indoor air quality. Ozone is a respiratory irritant. It can trigger asthma. It's not going to kill your COVID-19, at least not at these levels that you can use safely. Try to use no fragrance products and do not use antibacterial products. Here's a little more information on fragrances if you're interested in a toolkit. This is the thing I get the most complaints about from schools and public places. And microfiber cloths. If you can switch to cleaning with microfiber cloths, you can clean a lot more efficiently with less chemical, less effort. They can be washed and dried, and you can have color coded to avoid cross-contamination. And do not fog. EPA is not registering as in general products to fog for COVID-19. There may be some specific uses in hospitals. That's not an area I work in, but in schools and public places, there is no call for spraying chemical into the air. All surfaces do not need to be disinfected to prevent transmission of this disease. We're working on the high touch surfaces where people can touch them and then deliver the virus to their eyes, nose, and mouth. And remember, the primary means of transmission is, being too close to somebody who's infected, which is why the 6-foot separation. Here's some resources that might be of help to you and my contact information. And remember, there should be somebody at most of your health departments also that can help you. Thank you.
Thank you, Nancy. So what I have done now, we got a good recording this time. This is good. So I'm going to open it up for the questions that you've sent me. I believe I just want to make one more check one more time to make sure I have the 3 panelists open, which I do. So I'm going to read you some of these questions, and I apologize if it's a duplication of something you presented. Sometimes people get on a little late or something like that. So whoever wants to answer these questions is fine. So the first one is, what types of support can we provide to owners?
Hi, it's Tara. This sounds like this is about the voucher program property owners. We haven't specified that, so it's the funding notice. It's pretty basic. It's PIH 2020-08. I think the emphasis is on retaining owners.
Okay.
But that one, because that's a great question. I will get more information about that, and we can get it out to the person that asked or to the group.
Okay, thank you for that answer. The next one is, I believe it's also yours, Tara. The public housing fund money can be used for expenses starting when?
Starting the day that it was announced. It's not retroactive. So the notice on the public housing fund was issued on April 28th, 2020. Expenses incurred before that wouldn't be eligible, but we are going to publish. We've had certainly a lot of requests about that, and if there is any flexibility there, we'll publish that in the next set of FAQs or guidance. But for now, it's April 28th.
Okay, so this is sort of a follow-up question. I think you just answered this one, but just to make sure I haven't missed the subtleties of this one, can the PHAs use CARE funds to reimburse money that has already been expended before the CARES Act funds became available?
Right. The preliminary answer I've heard on that is no. We will issue more guidance, and if there is any flexibility there that HUD could offer, we will we'll publish that.
Okay, thank you. There's a question that came in. Do you have a written protocol step-by-step of what a housing authority needs to do when a resident has COVID-19?
I'll start that, but I definitely will pass it to my co-presenters. So we do not have a written protocol. We've put out a little bit of
Actually,
guidance.
before you,
Go
sorry
ahead.
to interrupt. Before you answer it, the same person asked a follow-up question while you're finding that slide. It says also, if a resident gets COVID-19, what does the housing authority do if they have no other units available to them to be isolated in? Would they be sent to a hotel to protect the others in the unit? So the protocol step by step, and then what to do if you don't have extra housing to move them in.
Right. Okay. Thanks. So the step-by-step protocol. No, HUD has not issued that. What we have put in our FAQs are some questions about resident health and if a resident becomes positive. What we're really hoping housing authorities do is that if they are in this scenario, that they're communicating with their local or state health department and advising whatever they or implementing whatever they advise. That is probably the most important thing here. And I say that because we're housing people. We don't always know the best steps, but we can link you to the right health people, and we can put out what guidance we have, courtesy of CDC and HHS. In terms of a resident getting it, there isn't any requirement to separate that resident from their family or move them from their unit. If you have an empty unit in the building, you can move a current resident to an empty unit if you want to. It's not required, but you wouldn't be able to, because of our requirements for the waiting list and preferences, you wouldn't be able to house a person that isn't already a public housing resident in that unit unless you have a set aside for, say, homeless persons to skip the waiting list. That one is a little bit more complicated. So do check our latest FAQs on the HUD.gov coronavirus page. And then if Dr. Murphy or Nancy have any other input on how to respond if a resident is positive, please jump in.
Definitely call your local health jurisdiction. I know I live in King County in Washington, which is where this all started in this, well, we thought it started. And I know we've been setting up places for shelter. So it's local health in particular, and sometimes state health that's working on that issue.
Great. Thank you for that
Tara,
answer.
I forgot to add.
Okay.
Can
Go ahead.
I add one thing there? You can use funds for a hotel unit. If the housing authority wants to provide temporary relocation, you can use funds for that.
So this is actually interesting because there's a follow-up question that just came in to the earlier question. And although this is not exactly the answer, a question to the answer you gave, it's an interesting question, which is, could funds be used to purchase a house to be used as a quarantine house?
That is a good one. We haven't specified that, but that's something that I can put through to our funding expert to check on. It seems a stretch if you could provide temporary relocation, and it's not like it's a permanent condition, and people do emerge from quarantine. So that seems like a stretch, but I can put that through.
Okay, a couple more questions. Really appreciate the presenters answering these questions. One of them came in, and I know we addressed fogging, but the question that came in while you were talking about fogging was, wouldn't fogging be appropriate when decontaminating a unit that may have had a COVID-19 infection?
Well, if you want my opinion, no. Opening the windows, airing it out, the virus is going to die off. The fogging leaves a lot of chemical residue, and it's just a great overuse of chemical. I'm a very big proponent of airing buildings out.
Good answer.
Jennifer.
Yeah, go ahead.
Just from CDC, I agree completely. And again, CDC really does suggest following these recommendations for disinfectants and really using those as they're prescribed. And when it really comes down to disinfecting these spaces, focusing on those high touch areas with some of these disinfectants that EPA suggests is really the best way to go about the disinfection process.
Fantastic, thank you. So we'll take two more questions. One of them is, can the surfaces be disinfected with UV light? I know there's a lot of advertising on the air and media about that, so we probably ought to address that.
Not safely by normal people. That's something for hospitals to do under their specific considerations, in my opinion.
Okay. Then the last
Did
question is,
CDC want to add anything?
I agreed with you on that. Again, that isn't something that falls under the EPA recommendation, so that's not something that we are suggesting people do right now.
I
okay,
think also people really need to know that when they're talking about UV light disinfection, there are really specific ways that UV is used in certain environments. None of them are appropriate for general environments, or nor are they going to work effectively. But I'm perfectly happy if people want to put things outside in the sun for a day or two.
okay. Thank you for those answers. Last question that came in. I know we touched upon this a little bit, but just to remind everybody, how effective are cloth masks? Wouldn't those be appropriate for resident and staff to both be wearing when interacting to prevent illness? And just to bring everybody up to speed on this webinar, we also got a question on the other webinar about whether visitors should be wearing any mask at all. So could you, the three of you, answer both of those?
I'll let CDC take the mask one.
Sure, yes. So CDC is advising the use of simple cloth face coverings, and that's really to slow the spread of the virus and help people who may have the virus but not know it from transmitting it to other people. So it's really important that these cloth face coverings that we recommend are not surgical masks, and these are not N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders. And so, yeah, I think, you know, what we'd like to see is everyone is wearing these, and that really does prevent, we think it prevents the spread, the person-to-person spread, especially from asymptomatic people.
I'll just add that I know our health department has taken the federal guidance and developed guidance that's on our website. I'm sure other health departments are doing it, because we get a lot of questions about food service, about inspectors, you know, eventually schools. So you can find more specifics usually from your local health. Our latest one to come in today is with wildfire smoke, and I can tell you cloth face coverings are not going to help with wildfire smoke. So we're going to have a very interesting intersection with two health problems if we get a bad season again.
I wasn't trying to laugh with everybody, but it's just, yeah, it's just if we don't have enough problems already, right?
Right.
This is CDC again. I just also wanted to just make the note that cloth face coverings should not be placed on young children under 2. And we also advise against using them on people who have trouble breathing or who are obviously unconscious or incapacitated or who aren't able to remove the masks without assistance. So.
Thank you for that answer. Go ahead.
Michael, it's Sarah. Just to add a reminder for housing authorities that we have advised them that you can put restrictions on visitors. We ask that you make it part of an overall pandemic response policy, and that be publicly posted and made known. With respect to face masks, if you were to require anyone coming into, say, the office or a common area to wear a face mask, you might want to include those provisions about children under 2 or people with breathing issues.
Okay, that was great. So before we wrap this up, I wanted to thank all 3 presenters, Jennifer Murphy, Nancy Bernard, and Tara Radosevich. This was a fantastic webinar. I know a lot of people learned a lot from this. I want to follow up with a couple of things before we end the webinar. Our presenters have graciously offered to look over the additional questions that you may have had either through SurveyMonkey or from today and sort of create a FAQ page that you'll see sent to you. You'll get a link to it that you can get to it. I also want to remind you on the handouts that we're going to be reposting those 3 handouts. We're going to try to make that 3rd one work. I know half the people can upload it and half the people can't, but we're going to try to fix that. And then the recording, you'll get an email very soon within the next day about where to find the recordings for this. So do the presenters have any last thoughts they want to give?
Stay home.
Okay, good advice. I know I'm home right now. So thank you all. And at this point, I will be stopping the webinar.